I wanted to ask you about another section of the proposal called the continuous coverage provision. Apparently, this is a replacement for, to some degree, for the mandate, but under the old mandate, people would have to pay a fine if they didn't have insurance to the government. What happens now under this continuous coverage provision?
So the so-called individual mandate in the ACA is by and far the least popular part, although it is essential for guaranteed issue and eliminating pre-existing conditions. But the current ACA mandate basically it's not a mandate. You don't have to buy coverage. However, if you don't buy coverage and you're able to afford it, then you face a tax penalty when you pay your taxes of up to $695 for a full year without coverage or a % of your income. The Republican plan gets rid of that. It reduces all those penalties to zero, and it puts in place a different kind of a penalty. And the penalty says that if in the prior year, in the prior 12 months, you had a gap in health insurance coverage of more than 63 days, then when you go back to buy health insurance, you will pay a premium on top of your premium that will represent 30% more. So let's say that I had a gap in coverage and I want to buy health insurance in the following year, and I want to buy an individual policy that costs me, let's say, $7,500 in a premium. So I would pay on top of that a penalty of an additional $2,200. So the maximum penalty under the ACA is $695, but you're looking at a penalty here right now to replace the individual mandate that is significantly more punitive and more difficult and will in fact keep many Americans from being able to get back and buy health insurance once they've had coverage. And there's no hardship exemption, there's nothing. This is on everybody if you had a gap in coverage of more than 63 days. So it will be a real impediment from people who say, okay, I'm ready now, I'm able to afford it, and I want to buy health insurance coverage. It's not making it easier for people to get coverage, it's making it harder.
And there's also a difference, isn't there, in that the penalty under the Affordable Care Act went to the government to supposedly help defray the cost of the overall plan, but this additional premium would go to the insurance companies, not to the government, to basically help their bottom line, right?
Enough said.